Hello, welcome to the webinar on the Psychiatry Note for Behavioral Care Solutions. I am starting this webinar on Google Chrome on my computer on the web page for www.wrshealth.com. We are a web-based EMR platform, so as long as you have internet, you can access our EMR through either Google Chrome or Internet Explorer. We are not compatible with Safari or Mozilla Firefox, so as long as you're on Internet Explorer or Google Chrome, you can access our website through www.wrshealth.com. So if you're using an iPad, you'll need to make sure to download Google Chrome to that iPad. From our main web page, the very first time you log in, you can scroll down to the bottom and hit Practice Login, so it's in the bottom right of my screen. And once you click on this, it will take you to the login page. We allow you to set our page as a home page or bookmark right here, but you can also do that through Google Chrome. On the top right of your screen where I'm hovered, it says bookmark this page is the star. So you're just going to either use our feature or the feature for Google Chrome and bookmark the page, and then you can always quickly get back to the login screen for wrshealth.com. So once you've input your user ID and password, you'll click the green login button. And it is taking me here to the screen. So this is what your main screen will look like whenever you log in. And so again, you'll access this with your username and password. So any subsequent times the login screen will look like this. Once you log in with your username or password, you are going to get to the first screen, which is your login location. And this is really important. The login location is how you designate where you are creating the note for the patient that you are creating your notes on. So it's really important for two functions, both clinical, date and time stamping your note in the correct location for the patient, and for billing, that at this very first screen you access the correct location. In the white box here that now says Diamonddale Nursing Center, if you click on it and start typing, it will take you directly alphabetically to what you type in. So this is a really long list of like 300 locations. So the best way here is just to type what location, and you see as I started typing WH, it started pulling up all the locations that began with a W. So that's the fastest way to access the system in the correct location. So using your mouse or stylus or finger, you can touch on what you want it to say, and now you'll be logged into that location and you can access your note and have it date and time stamped in the claim stamp properly with the right location. So after you've chosen location, you will use the blue Go button. And now you are in the main section of Waiting Room Solutions. This takes you into the messaging module. So our home screen for you is the messaging module. This is a really nice feature that you guys could message each other to collaborate on patients' care. So you'll see it's separated into emails and tasks. The main thing that you could do is create emails for your colleagues about a certain patient. It's secure messaging inside Waiting Room Solutions. So this will not email anybody's personal email when you're logged into the system. This is the sort of intra-mail or secure messaging within Waiting Room Solutions. So they'll only see it if they're logged in. So to send a colleague a message, you're going to click on the blue-gray button and click on Message. The green Resources tab is always highlighted, so in the white box here that says Select, you can just start typing in the name of the employee, and all of the names are located here. So just choose your employee, turn them blue, then you can start type your message here. And this is a great feature for you guys to collaborate on care with your fellow colleagues. So I have a one-time only preference that I need you to set. On the top right-hand side of the screen, there is a green tab that says Preferences. Please click on Preferences, and the very bottom option says Theme Settings. If you choose Theme Settings, if you are accessing the system with an iPad or a tablet, please change the mode to True and hit Save. If later you are accessing our system from a desktop or a laptop, please come back to Preferences, Theme Settings, set it back to False, and hit Save. So you will have to change this setting based on what kind of device you use to access the system. So Preferences, Theme Settings, iPad tablet mode true if you are accessing the system on an iPad or a tablet, or false if you're using a desktop or a laptop. So this would be a one-time only setting if you only accessed the system with the same device. If you're always going to use a desktop or a laptop and you're not going to use the iPads, you don't need to go here at all. So once you're logged into our system, you might have created any messages from your colleagues. Probably the first thing you want to do is figure out how many patients you need to see at this particular facility. So how you are going to always access your schedule is by the recall list. So in the second tab up here on the top left, it says Scheduler. If you touch or click on it and you go to the fifth option that says Patient Recall, this is going to allow you to use 3 different filters to pull up your recall list. So the 3 pieces of data you'll need is the date. Do you just want today's, the next week, the next month? You can filter however you want. Patient location. Even though you're logged into a particular location, you are still going to need to use this filter to decide where you want to see your recalls for. So you can plan ahead. If you're at one location and want to see the next location, you could always redo this filter for seeing what you have to do next. But if you're creating your recall list for where you are right now, then choose the location where you are right now. The third feature of the filter is appointment type. This drop-down box will designate the 4 different types of appointment types in our system. So if you're an NP or PA, you're going to choose that. If you're a psychiatrist, you're going to choose that. If you're a psychologist, you'll choose that, and then social worker there. So you're going to filter based on date, time, and appointment type. I'm going to hit submit and hope I find some test patients here. You can see we've downloaded a lot of data here, so you'll have a whole lot of new patients. So let me see if I can find any recalls here that are test patients so I can have one to access for you. So once you use the 3 features to pull up your recall list, you will see that the list of patients you're to see appears here in this order. So I have a couple recalls here today, and we are going to start seeing our patient through the recall list. So your recall list will be really important for you to get whenever you go to a location so you can see who to see, and then maybe at that location you want to go ahead and rerun it for the next location so you can be organized for that. What also may happen is once you print your recall list, there may be other patients that you're asked to see whenever you're on the floor. And so what I want you to do is first search for that patient in our database. There's over 10,000 patients in our database that your facility has seen before. So you would want to go ahead up in this white box here, go ahead and search for a few characters of the first or last name and hit search and see if the patient that they're asking you to see is actually in our database. If they are, I'm going to be teaching you today how you can add that patient to your recall list for today. If they're not in the database, you have 2 choices. You can add the patient yourself to our database, or you can call your PM and they will add the patient for you. So to add a patient, you're going to use the tab right next to Schedulers, and it's Patients. The first drop down is Patient Registration, and you only need 4 pieces of data to add a patient to our database. Even though you'll see red stars next to More, we've programmed our system to allow you to do a quick add with only 4 pieces of information: their name, first name, last name, their date of birth, their social security number, and their gender. So you only need 4 pieces of information to add them to our database if no one has ever seen them ever in our system and you've already searched for them. You'll scroll down and you do need to bubble in the signature on file for both the privacy and the assignment of benefits for you to be able to create a note in the system. So add a patient is patients, patient registration, 4 pieces of information: name, date of birth, social security number, and gender, and please hit the signature on file for both privacy and assignment of benefits. You'll hit the blue Submit Changes button, and the next screen will ask you to add the insurance. Please just bubble in self-pay and save, and the PMs will add the insurance for the patients for you. So 2 different workflows. One, you'll come in and you'll print your recall list by going to Scheduler, Patient Recall, and search for your patients by the 3 filters: the date, appointment type, and location, and hit submit. Once you have your recall list pulled up with the name, those 3 filters, you're going to start seeing patients and creating the notes from this list. So what you will do is on this horizontal line somewhere, but not directly over the name, if you're on a desktop or laptop, you'll right click. If you're on an iPad, you will just touch and it will pull up this second screen, and you will hit create new note and close recall. So from the recall list, you will touch on the horizontal line that has the patient's data, and then you will right click or touch and see create new note and close recall. This will allow you to open the note, and that patient will be taken off the recall list. So now the note is open for you to create. I have one more piece of setup for you to do the very first time you access our system. So you only need to do it one time. If you are on a desktop or a laptop, you'll see your screen just like mine. You'll use the drop-down box, and the very bottom option says Customize. If you'll choose Customize in a new tab or window, which is a very important thing in Waiting Room Solutions, basically our whole system opens up and pop-up. So everything opens up in a new tab or window. So in the first tab of Google Chrome, I have the system, and the second tab, I have this new screen where I would like you to set your favorite note types exactly like my screen is right now. So please put a check mark in front of blank note. Please put a check mark in front of phone message. If you're a prescriber or would like to access the medications page, please put a check mark in prescription note. If you're an MP, PA, or psychiatrist, please put a check mark in psychiatry note. And across that horizontal column, please set that as your default note. So if you're an MP, PA, or psychiatrist, a one-time setup only is setting these note types and also bubbling in the psychiatry note as your default. If you're a psychologist or a social worker, please put a check mark in SNF psychology note and therapy note, and please bubble in for you the default of the psychology note. It's just going to be a time saver that every time you open a note, you'll either be in the psychiatry note if you're an MPPA or psychiatrist, or the psychology note if you're psychologist, social worker, or therapist. So I'm going to run tonight's webinar in the psychiatry note. There's a separate webinar for the psychology note as well. And I'm going to show you how to put in data in each of the boxes, and you will do the same workflow every time you create a note in our system. These gray tabs right here that I'm highlighting over are just live web pages for different pages of the note. So you could always skip pages and go straight to them. Please remember that our system does not have autosave built in. So save, it will be accessible several times on the page with these blue buttons. So please make sure you use the save button frequently to save your work. If you would navigate away from this page or lose your internet, any work that you had not saved would be lost. So please hit save frequently. Save and next will save your work and take you to the next page of the note. And you could always navigate back if you wanted to go back to the previous page. So save or save and edit will save your work and keep you on the same page of the note, and save and next would take you to the next page of the note. So the very top box is referring provider. So you could go ahead and just type in the referring provider and use the calendar feature to access what date the referring date was. The chief complaint box is just a box for free texting, so you can type in whatever you want to say is the chief complaint for this note. If you're using the iPad, you could use voice recognition texting in any of the boxes throughout our system. The second box is the HPI, the history of present illness. There's 3 ways to put data here. You can free text like you see me doing. You could dictate as well with that voice recognition if you're on an iPad. The third way is to use a HPI template. And HPI templates are optional. They are a nice way to put a lot of data in the note. So I'm going to show you how they function, but some people will never use HPI templates. It's just an option for putting data in the HPI box. A lot of people just free text. You can access the HPI templates that we have provided for you by touching on the drop-down box where it says no template. We've given you 5 or 6 templates here: alternate HPI, the antipsychotic dose reduction, consent to use psychoactive medications, informed consent to participate in telemedicine, psychopharmacological dose reduction, sedatives and hypnotics dose reduction. So I'm just going to show you how the templates work. Again, they're completely optional. If you choose a template, it's going to pop open in the box and it looks really messy. But the way this templates function is the creator of the template has asked some questions and given you preset answers, and you just need to touch on what you want it to say. So the creator of this template put in diagnosis, and then you can touch on delusional disorder to have that be your answer. The next question says, if dementia related, identify harmful behaviors. You can touch on what you wanted to say, and the strike through remains on all the other answers. Sometimes the creator of the template will allow you to use more than one answer, like this one. So hitting and kicking and paranoia were my answers. If you scroll down, the next question is about the GDR. Again, you're just going to touch on what you wanted to say, and everything else will keep the strike through. This is just a bunch of free texting that will stay in your template. So this saves you a lot of typing if you use this template. You just have to answer these 3 questions. The way the template works is you have to use save and edit. It's very important that you remember that save and edit flattens out those choices in our template and allows it to function properly. Save and next can work, but we really need you to use save and edit after you apply a template. Just remember, once you apply a template, then you can free text, but do not free text and then apply a template because you'll lose all your information in the box. So the way the system was designed is templates take priority, so template first, then free text. And these boxes function just like Microsoft Word, so you can backspace, cut and paste. So if you've typed a whole paragraph and then decide to do a template, just go ahead and highlight it and hit cut or copy and paste, and you can use those features just like with Microsoft Word. If you would like to use 2 templates inside one note, you would have to use this green box to the right that says Add New HPI Template. So you would have to touch on the box, and you would see now a second chief complaint for a second template, and then you could employ a second template. So you would just choose it from the list, and maybe now you want to do the sedatives and hypnotic dose reduction. So if you want to use 2 templates, you must use the Add New HPI box. They still function the same way. Touch on what you want it to say. Everything else will have the strike through. Some of these templates have very few options, so you can just touch on it and hit save and edit, and it is a really fast way to put that data inside your note. So chief complaint and HPI templates here. The next section is review of systems. You can see that there's this full 15-point review of systems here. Each box is going to function the same way. You can touch or click on the box in general. You can start free texting. You could dictate with the voice recognition on an iPad. You can see when I popped open the box, it gives you some preset options that we have given you. So you can also put data in the boxes this way by using your mouse or your stylus and clicking on what you want it to say, and it's typing it for you in the above box for general. Each box is customized per user, customizable, so you could use the blue Customize List box. In a new tab or window, you could add an entry here, and you could make it your normal. You could move things up and down. You could modify or delete options we've given you. So this is a really nice way to make the system sound like you. So you can designate what's going to be your normal and what your boxes would say. I'm not going to see your customizations, and you're not going to see mine. So anytime you program the boxes, they're going to program based on what the user has set as their customizations. So you can use the in button to populate your normal, you can free text, you can use the options we've given you, and every box is customizable per user. So this is a really nice way to get the system set up before you go live so you can make the system sound like you. We do have one blue box over here to the right that says normal review of systems, so you could employ that box and then free text any negatives if you wanted, or you could cut and paste or delete things. So anytime you want to do that, you could use the normal button. We also have a button that says clear all fields. It could clear it all out and you could start all over. For our system, whenever you create notes, the review of systems will carry forward for you from one note to the next. So if you saw this patient last week, you're the next person to open the note. The review of systems will carry forward. It may be that you've opened a note that somebody else saw the patient and you were seeing somebody else's review of systems. So that's the most common reason to clear all the fields, because if someone else wrote the last note on the patient, you could look at it, but if you would like to change it or wipe it out so you could start fresh, you could hit clear all fields. If you like how the other person charted the review of systems, you could just leave it, or if that review of systems was made by you. So the review of systems does carry forward from one note to the next, even if you're not the person that created that note. The next section is the past psychiatric history. It has radio buttons, free texting boxes, drop downs to say whatever you want it to say. One of the nice things about our system is anything that you don't want to address in the note, you just leave blank and that whole section would not appear. So if you didn't want anything next to health screening, if you leave the box blank, the word health screening in the review of systems doesn't show up. Same thing everywhere throughout our note. Anything that you don't want to address, just don't answer the data in the note. So if you don't want prior history of suicide attempt to appear in your note, just don't answer that question. So you don't have to delete anything from our notes, just don't answer it and it won't appear in the note. So there's free text box and radio buttons here for any information that you want to appear in your note. The substance abuse history is radio buttons and text boxes. Again, if you don't want it to appear, you could skip it. There are free text boxes next to every section. There's also an additional comments section here for free texting. The past psychiatric history has radio buttons and free text boxes for you to use. Again, if you don't want it to appear in the note, you can just not answer the question and it won't appear. The very last section here, a complete psychiatric history, substance abuse, you're just going to touch on what you want it to say, and that is the answer that will appear in your note. And then at the very end, you'll definitely want to save your work. If you hit save, it's going to save your work and you'll stay on the screen. If you hit save and next, it's going to take you to the next page of the note. Again, these gray tabs are the pages of the note. So if I hit save and next from this page, it's going to go to the next page, which is histories and habits. Histories and habits is basically the past medical history for the patient. You can use the check boxes to say that they don't have any medical problems, or the blue add new box in each area to add a condition. So here you're just going to want to add things that you want to appear in your note. If there's really nothing relevant, you could leave this area blank, but it's nice for you to put at least one or two pieces of relevant information for the patient. You can put as much or as little data as you want in the note. If you don't know the date of the condition, you can skip that. And so again, you can build your list here by putting in the pertinent medical history that you want to appear in your note. Surgery, we have a box that you can check that if they don't have any surgeries, the blue add new button will allow you to free text any surgeries that you want to appear in your note. Family history, we have a box again, if they don't have any relevant family history, or the blue add new box, you would just pick the person. It's the same list of diseases from above and hit submit. There's always going to be a free text box at the bottom for any kind of conditions that are not on the list. And then hit submit. If you want to put a second family history in, so now we've put three things in about the mother, hit add new, change the drop down box to the father, and then again use the radio buttons or free text, anything you want to appear in the note. Immunizations, if you don't want that to appear in your note, you can skip it. We do have a yes/no question, or if it's relevant to your note to put in exact time and immunization, we have a full immunization tracker built into the system. Social history, we have the ability to chart several different ways how you want this data to look. You can use the radio buttons up here for smoking. For alcohol, you can do yes, no. You can be very specific. If you don't want to address it, in the way you see me on the screen, you don't have to. So there's lots of different ways you can chart their social history. We do have drug use, sexual activity as well, other habits and comments. Again, as much or as little data as you want to appear in the note. There is a Save Social History button for this particular section. Anything else up here, once you see the data, you know it's been saved on the page, because everything in our system is date and time stamped, who put it in, so you can see right here that it's date and time stamping that I am putting this data in. So when you open a note on a patient, you can see exactly who's created this data for your patient. The next page of the note is the medications page. On this page, on the right-hand side of the screen, it's relevant for you to address their allergies. You can check the box to say no known drug allergies. You can use the blue Add Allergy button to pull up the allergies. You'll type the name of the drug in the white box. As you start typing, it will access the SureScripts formulary. You can put a reaction. You don't have to, but if you do put a reaction, the reaction will appear in black underneath the allergy that appears in red. So whatever allergies that are relevant for you, you'll just put it in. If someone's already seen this patient in the system before, you might get here and find that there's already data here. So your job throughout all the pages of the note is to make sure that the note is accurate for the date you're creating the note. So this patient is now documented with a penicillin and Keflex allergy in our system. The next feature you'll probably use is to build a medications list for this patient. Again, as much or as little data as you want to appear in your note, maybe just the relevant medications for your profession. So if you start typing in the name of the drug in the white box next to the word drug, if you start typing in, again, it's going to access the SureScripts formulary. Hopefully you know the exact dose. Every dose of that drug will show up, but unknown dose is always an option. So you can put in the exact drug just by touching on Lexapro 10 milligrams. We have a blue button for you at the bottom of the screen that says Add as Current Medicine. And what we're doing is building a medications list for this patient to appear in your note. So if there's maybe one more medication that you want to appear in your note, you'll just start typing it. You'll select exactly which preparation of Wellbutrin, and again, access the blue Add as Current Medication. I've never seen a medication not be in the formulary, but you can free text any medication that you might not see in the formulary. It won't be built in with the NDC code if you don't complete it using the drop-down feature, but you can free text a medication if you happen to not find it in the system. If you're a prescriber, you can prescribe in our system and print these prescriptions. There's 3 different ways to do that. You could type right here in the name of the drug and just access it like we just did to add a medication. But this time you're going to need to fill in the SIG pad if you actually want to print this and have it be a valid prescription. You're just going to fill in the number of days. It's going to do the math for you, the number of refills if necessary. But this time you're going to use the blue Add as Prescription button. When you add it as a prescription, it's going to put it on the top of the page under Current Note Prescriptions. And here you can access the 3 buttons, Print, Send, or Fax. Most of you are just going to use the workflow that you could possibly print a prescription. It will print to the computer that the printer that your computer is set up to. So if you have a Wi-Fi printer or you have your own printer connected to your computer, it could print there and you could leave it. So you can print your prescriptions for this screen. This may not be a relevant function for you, but you can print your prescriptions on this page. So this page is about entering the allergies that you want to appear in your note, printing the medications that you want to appear in your note, and creating and printing any prescriptions if that's relevant for your role. The next page of the note is the psych exam. At the top of the psych exam is the vital signs area. It stays collapsed until you pop it open. So you need to touch it with your finger or stylus or the mouse, and you need to enter 3 pieces of vital signs. So whichever 3 you find relevant to the patient's chart, it's required that you guys enter 3 vital signs here if you're an NPPA or psychiatrist. There's lots of choices here for you. Again, any vital signs that you don't enter just don't appear in the note. So if it's relevant to follow weight and blood pressure for this patient, you can use height, weight, and blood pressure. The BMI will populate for you. There is an area at the bottom that you can use to store data for the AIMS, the discus, the mental status. So you could use these areas for vital signs as well to store data. You have to hit save to save your vital signs. So if you hit the blue save button, it will save your work and collapse the box. If you want to see the history of the patient's vital sign and they have more than 1 piece of data, then it will show right here. So this patient's only had 1 note. This note created, and so there's no data. But in the future, all of the data for the vital signs is stored. There is some free text comments boxes to the right if you think there's something you want to chart here about the vital signs. So save your work with vital signs to collapse the box. The physical exam, Functions just like the review of systems that we've already learned. You're going to touch on the box, it's going to pop it open. You can free text, you can dictate with text recognition, and you can use the options we've given you. Again, every box is customizable per user, just like the review of systems. You would touch on customize list. You could add an entry. You could change what's your normal. You could move things up or down. You could modify or delete any of the entries we've given you. So again, another place to customize the system before you start creating notes is inside the physical exam. So review of system and physical exam function just the same. You have the in button for populating your normals. You can free text. You can dictate. The in button over here to the right would allow you to put all the normals for the mental status exam. And again, just like we've mentioned through the other text boxes, you can free text afterwards. So you can use these 3 different ways to put data in: free texting, or using the boxes, or dictation in any order you want. The final section is musculoskeletal, and then the additional comments area. Again, anything that you don't want to appear in the note, just don't check. The final section on the exam page is coordination and counseling. This one has a scroll bar, so you can address what you wanted to say by touching on the answer. You can also use the control feature if you want more than one answer that we have given you over here to the right to appear. So history, coordination, and counseling, you're going to use the scroll bar and pick whatever option you want it to say. Then the matters addressed indicated in this note. Again, it has a scroll bar. So you can adjust whatever you wanted to say for the answer for this note, turn them blue. There's a save at the bottom of the page, and that will save your entire page worth of work. Remember, save, save, save as frequently as possible, especially if you're at a facility that might have sketchy internet. Save frequently so you don't lose your work. So the blue save button keeps you on the page and saves your work. Save and next will take you to the next page of the note. The next page of the note is called Assessment and Plan. It is all about ICD-10 codes. So this is how you're going to associate codes with today's note, which will also populate the claim form, and you can free text your plan. A couple different ways you can put the codes on the note. The easiest way is from the super bill. You just check the boxes in front of what you want to code this note, as few or as many as you want, and use the blue Add to Current Note Assessments. So now I've coded 4 codes for today's note and 4 codes to today's claim form. There is a status box next to the claim, so if you want to use this area to designate if they're new or established or chronic or deteriorating, you can use that feature. The box next to each diagnosis is for the plan. You can free text your plan here, or you could dictate with voice recognition if you wanted. Another time saver here is this D circle that you'll see throughout the system on various pages for a default plan. So if you had a great plan on one patient for Alzheimer's disease, you could keep, texting your plan. And then if you think, hey, this is a great plan, I want to save this for all my patients for this Alzheimer's disease code G30.9, if you hit the D button, you are going to save that free texting for that user for that diagnosis. So defaulted comments are user specific and code specific. So in this case, if I free text a plan and I like it for Alzheimer's and I want to use it on every patient, it's going to store it as a little bitty template or a little bitty macro for you for that code for that user. So I won't see your defaulted comments and you won't see mine. And you can do as many or as few as defaulted comments as you want, but they're a really big time saver. The other feature right here next to the diagnosis is this red I or green E button, and both of these are about educational materials for the patient or their family. The red I are practice loaded instructions, so if you click on them, you'll see that the practice has located some specific instructions for these particular diagnoses. You could print them and leave them for a family member. The green E button will take you off our website to the Medline library, and it will give you their handout for that particular diagnosis. So you have 2 different ways to see it, a handout. If you see the red I, it will be a practice loaded instruction. The green E will be the Medline webpage. Another way to code on this, as you use our system, you're going to see there's a users and practice most frequent area. So you could also use your most frequent. As the system starts watching you, it will save your top 25. You can use the control key here to hit more than one. So you could come to this page and find that you could use diagnoses that you've used before in other patients under the users most frequent, turn them blue, and hit add to current note. This is the second page of our note that third page that carries forward. So the review of systems carries forward from one note to the next. So does the physical exam page. So both of those areas, when you open a note, you may find data there that could have come from you the last time you created the note, or could come from a colleague. So anytime you get to the review of systems or physical exam, make sure those pages say what you want for this particular note. The third place that the data carries forward is right here on the exam page. So it may be that you open up a note and there's already diagnosis codes here. So if there are codes here and you don't want them to appear, we have check boxes in front of them, and the delete button will take them off your page, which takes them off the note, which takes them off the claim form. But it could be that this diagnosis really is relevant for this patient, it just isn't relevant for today's note. And if you don't want to delete them, we have added a feature over here called Include in Note. So if this patient does have anxiety disorder, but you just didn't address it in today's note, and you don't want it on your note or your claim form, you can uncheck the box for Include in Note. So it will save it there for you or your colleagues if they want to use this for a patient the next time. But you can take it off today's note and today's claim form. Another area for free texting in this area is disposition, and it's a huge time saver. The disposition area, you can free text. This box functions just like the review of systems, just like physical exam. It's also a customizable box, so you can see here on the right the blue customized list. And this is a good way to add customizations, things that you say frequently, like frequent education plans, frequent consents. I mean, really, you could customize this area a lot, and just check the boxes of what you want to add in this note. So anything that you say frequently that's not related to a diagnosis code, it's nice to create a disposition for it, so that way you don't have to type it on every patient. So assessment and plan is all about ICD-10 diagnosis codes and your plan for the day. Save would keep you on the page. Save and next will take you to the next page of the note, which is orders and procedures. This page is all about CPT coding. So you can use the service level coding here. You'll change the drop-down box to nursing facility. And you can see when I change that drop-down box, it changes your radio buttons. Now you can just bubble in what you want it to say. And then we have a blue button to the right to save service coding. So you'll just change it to nursing facility, bubble in what you want it to say, and save service coding. Also on this page are any CPT codes that you want to bill for. So you're going to use the super bill that we've provided for you. You're just going to check the boxes in front of it, just like we did on the page prior, and then hit add as procedure. In Waiting Room Solutions world, everything that's a procedure is a billable code. So just check the CPT codes that you performed on the patient and you want to bill for, and you're going to use the blue button for add as procedure. So now at the top here we have your CPT coding and the two CPT codes that you want to bill for. So you have service coding and CPT here. If you're a provider and you want to chart anything that you're ordering on your patient, then again, you're going to use the same feature next to the CPT code. Let's say you want this patient to get a CMP and a folic acid. Now you would use the blue button, add as order, because you're not billing for these. You didn't perform them. You're just charting that you want the patient to get this ordered. So this could be labs, x-ray, radiology. Again, if you're the kind of provider that does do the true ordering, you can designate that here. Some people just annotate it in their plan. So orders and procedures is all about assigning CPT codes for both your claim and your note, adding as a procedure, and using CPT codes to add as order. Again, using your super bill is the easiest way, There is a search function on both pages. The search function is here at the top of the page for CPD. It's in the middle of the page over on the ICD page. It's not a super efficient way. There's 80,000 codes in the ICD page. There's probably just as many here. And so that's how you'll use the search feature, but you have to think like the coding book. And so again, if you know the exact code, that's going to be a nicer way to search, but the best way to add any codes on your note is just use the super bill. Okay, save would save your work on this page. Save and next will take you to the next page of the note, which is complexity, coding, and consideration. Again, there's free text boxes here for you to put how many minutes you spent with the patient. There's a text box here for any additional charting about medical decision making. Boxes for you to put your start time and end time. Again, the indication for visit is going to function like those other pages in the system where you're just going to choose what you want it to say, and you can use the control key to designate more than one answer. Again, scroll through here because we've given you a lot of preset options. Interactive complexity has a free text box just like review of systems. So again, you can use dictation, you can use your normal button. We've given you 4 preset options. Again, this box is customizable per user. And the note and treatment plan, again, free text, use the options we've given you, dictate with your voice recognition. This box is customizable as well. So for complexity, coding, and consideration, again, you'll address these areas. Make sure you save your work. If you hit save, it'll save and keep you on the page. Save and next will take you to the last 2 pages of the note. You might not need the AIMS testing and discus testing. If that's the case, you're done with your note. You can leave those 2 pages blank. I'm going to show you how they function. Save and next would take you to the AIMS test. These are radio buttons. You just bubble in for the quiz. And when you get to the bottom of the page, you'll see it's scoring it for me. So its functionality is when you bubble it in is changing the score. So again, if you performed an AIMS or a discus, this is a really nice way to chart it. If you didn't use it, you don't even need to go to these pages of the note. The discus is going to function the exact same way. You just bubble in what you want it to say. It's scoring it for you at the bottom of the page. So again, if you don't need to use these 2 pages, then you are done after complexity and coding. But if you need them, they'll always be available for you. Remember, anything that you don't address in our system just doesn't appear in the note. So now you've done your entire note start to finish. You're going to use the blue View Note button because I want you to view your note and see how it looks. So when you hit blue View Note, it's going to allow you to proofread your work. There is not a spell check built into our system. It needs to be added to each device that uses our web-based system. So you can make sure to add spell check to your particular device. But you can look at your note for clarity. Remember, we're opening in tabs across Google Chrome, so the View Note is in one tab, but the actual note and WRS Health and the web page is in the other tab. So you can be in one tab and say, oops, I forgot to put in some medications. You'll go back to the original tab and use the gray tab for medications to go back to that page. Then you can go back to View Note if you want and look for other things that you've charted, and then go back to the original note and make any edits. After you're positive that you have the note done exactly like you want it to appear, I'm going to want you to sign your note. You can sign your note with the blue Sign Note button when you're actively preparing a note, or you can sign your note from the View Note screen as well. It's at the very bottom. Once you sign your note, it's going to be date and time stamped, and it's going to be sealed up, and there will be no way to modify or edit or add to the note. You can only use the addendum feature that's available in the View Note field. So once you sign your note, there is no way to add anything to it except using the addendum feature. So you couldn't access billing or the medications page. If you truly sign the note before you were done, just on accident, you might have to create a second note for the day and make a little annotation that you signed your other note without finishing it. So once a note is signed, it cannot be unsigned or dropped from our system. So after you've created your note and viewed your note, the last thing we're going to want you to do is sign your note, and then you will be able to fax or email the note to the nursing floor, your PM, or wherever this note needs to go. Today, the email button has not been added to the system. It should be added sometime this week, but you're going to fax the note by hitting the blue fax note button and just pretend there's a blue email note that will be here too. You can also print. So from the view note screen, you're going to be able to print, fax, and email the note out of our system to wherever you need it to go. When you hit blue fax note now, it's not completely finished, but this will be a drop-down box to all the fax numbers that you guys will use frequently, and you can just choose it from the drop-down box and hit send. Email is going to be the same way. When you hit the email button, there'll be a drop-down box of the email addresses that you use frequently. It's going to send it, and you'll hit send. So right now today, my screen's not showing the latest of the technology because that's still being finished. But from the view note screen, you'll fax or email your note. So now you've come to the clinic or come to the facility, you have used your recall, looked at who you needed to create notes on, created your note, viewed your note, signed your note, faxed or emailed the note. The very last thing I'm going to want you to do is put this patient back in the recall list. So this is super important. Once you've seen the patient today, you won't remember to see them in 1 week or 4 weeks or 6 weeks or 3 months unless you tell the system. So in recently viewed on the bottom left of the screen, every time you open a note for that login, those patients will be stored in recently viewed. So you'll just hover or touch, depends what device you're using. You'll hover over it with a mouse or touch on this bar that has BCS test, the patient's name, if you're using the Apple iPad. And you're going to go to this second column, second choice, appointment recall. So it's super important after you've created your note, signed your note, faxed or emailed your note, you put them back in the appointment recall. When you touch on appointment recall, it's already set to be a new recall. You have 3 things that you need to fill in. When do you want them to be seen? And you can choose that in numeric weeks or months. So if you want them to come back in 6 weeks, or you can use in the month of. Comments is really handy to type a note here to yourself or even to your colleague. And then the third thing is whose schedule do you want them to be on? So if you're a psychiatrist and you're wanting to put them on your schedule, then you can put them here for appointment type in 6 weeks for you by hitting submit. But a really nice feature is also that you may want this patient to be seen by one of your colleagues. So you can hover over that patient's name again, go back to the appointment recall, and maybe in 1 week you would like the social worker to see this patient. And then you could just use their schedule from the drop-down box. So now you could create a recall for yourself, but you could also create recalls for some of your colleagues. And then when they get to the facility and pull their recall list, they will see any comments that you've typed here, and it will show up on their recall list. So this is going to be a great way for you guys to quickly coordinate care for your patients. So you started the webinar with the recall list. You're going to end the webinar creating the recalls for your patients. It's this circular workflow. Monica will follow up with you guys as well about the next thing I'm going to talk to you about, which is that your current logs are going to go away and now are going to be replaced by signing the notes in the system. The third tab under EMR, current charts, will allow you to see how many notes you've created in the system. You can use the drop-down box for whatever date range you want, 3 days, 4 days, 30 days, and you can see all the charts you've created. You can see all your unsigned charts. They are going to be using this area to process payroll. So for specific questions on your payroll and how it's changing going forward, please see Monica or your PMs. But it's really important for you guys to sign your notes within 24 hours because that's the CMS guidelines. But signing your notes and creating your notes is how your current payroll is going to be, and the logs that you used to do are going to go away. It's real important that your PMs get copies of the face sheets so they can have access to that as well. So remember to get face sheets to your PMs so they can know in advance who's going to be in what facility. Remember to sign your notes in 24 hours. And you can go to this third tab here in the system under EMR, current charts. Use whichever date range you want, maybe for the past week, for the past month, for the past 3 months. You can use the blue recall, retrieve your charts to see all the charts you've created. The V button will let you view the note and then sign it if it needs to be signed. The S is just the super bill if you're curious about what was coded that day. So the V button from this unsigned area will let you view the note that you created on Kristen Test and then you can scroll to the bottom and sign it. And then back at the top is the fax email function. So it's the exact same workflow we talked about before. So whenever you're in EMR in the chart room, you can view your notes, sign your notes, fax and email your notes. It's going to be real important to stay on top of this area here so you can look for your unsigned charts and any charts that you've created. Remember that recently viewed down here on the top left, once you log in, is going to be any patient's chart you've touched then. So it's a real nice handy way if you're seeing a patient get interrupted and you go to another note and see another patient and you started several notes for the day but haven't finished them, they will all appear in recently viewed notes right here on the bottom left of your screen. Also, don't forget to search for patients on the top of the screen if you're asked to see an add-on that's not on your recall list. If patients were seen years ago and haven't been seen recently, but they were part of the database for behavioral care, then they were transferred into our database, so it's very likely the patients will show up here. So just use a few characters, their first and last name, and hit search, and you can find all the patients in the database. If they haven't been seen, remember to add them under patients, patient registration, just 4 pieces of information: name, date of birth, social security number, and gender. Scroll to the bottom and do the signature on file. Hit submit, designate them as self-pay, hit save, or contact your PM to have them add them to the database for you. So this has been the webinar on the psychiatry note. I hope you have found this information helpful. Thank you.